Hey everyone, I'm at FDRS and I ran into Dr. Wright and we got some things that we want to talk about because we like to be a little philosophical about how things go within this community and things that maybe it would be helpful for everybody to consider. So we're talking about how does somebody know if they should even be considering to have lipedema reduction surgery. Like, how do you know that? We heard from all different surgeons about all the different things, and so people are like, what's my next step? And so I'm like, hey, what do you think? How do we get this out to the people of what do they have to consider? So this is Dr. Thomas Wright. His practice is here in St. Louis just by chance. And tell the name of your
So we
surgical solutions.
Lipedema surgical solutions, yeah.
Okay.
And so first of all, thank you, and I it's an honor to speak with you, Beth, and it's an honor to be here at the FDRS, and I think that's a great question because I really think it's so important for people with lipedema. First of all, to understand this is a systemic disease, and so liposuction, and I don't like to call it liposuction, lipedema reduction surgery does not cure lipedema. And so even before considering surgery, your body needs to be ready. And that you need to have optimal nutrition. And there's so many great talks here, but we insist on everybody adhering or trying to follow what we call an anti-inflammatory diet that emphasizes low refined carbs, and we also encourage everybody and insist actually that they wear compression and can tolerate compression before they go through surgery, because the last thing we want to happen is someone to have a surgery and not be able to tolerate the compression, because that's critical. It's absolutely critical for the healing and for the proper.
It helps with skin retraction too,
It helps
right?
with skin retraction. It helps control the inflammation. It helps with healing. There's always some lymphatic impairment with lipedema, and that needs the support of medical grade graduated compression. That's going to be at least class 2, 20 to 30 millimeters of mercury, and that is critical for the optimal, the best success, and that's what we want for everybody.
And do you have them use the 20 to 30 before as well, or can they start at the 15 to 20?
So we will sometimes work our way up to the medical grade, or with layering, and but we before they have to be able to tolerate the medical grade before we can do before we want to proceed with surgery.
So when you say do you mean actual layering?
Yes.
Like you could wear two 15 to 20s?
Yes.
Okay,
Yeah.
I
So
should try that.
it's completely additive, and it's completely and the other thing is you can layer it, or they some people call it cascading it, where they maybe wear a knee high and then add a capri, and that's how you get. But it needs to go from your foot all the way up to the waist, to because that's gonna ensure it goes all the way into the lymphatic, the lymphosome, or the area where these inguinal drain, inguinal lymph nodes drain,
And then you also said, so with the nutrition, the goal of doing all of these things is to have the most reduction of inflammation you can possibly have before you go into any type of procedure. That's the thinking. I mean, aside from life, it makes life easier, but right?
Yeah,
it makes this surgery easier.
Yes, for sure. I mean, that perfectly said, because
so movement helps too.
Yes, yes. So we encourage movement. The best, the best is of course in water, because that has a counter pressure. It's kind of the ideal, but any movement helps. And we do, because we do recommend low impact. It's variable. Some people can tolerate higher impacts, but everybody will benefit from low impact. Even just walking, cycling.
So basically, if somebody is out there walking, they're cycling, they're not doing any kind of, jarring to their joints or whatever, then that's a good thing before.
Yeah.
Actually, water is the best recommendation before.
Right.
And then during, they need to make sure that they can, at minimum, get some kind of steps in, right? Because they got to move that from day one, right?
That's right. Yeah, for sure.
Okay. See, this is information that we don't hear people talk about, right? I don't know about you, but nobody's really saying like these are the rules or the steps or what you got to think about. So, like, are you going to be? I mean, one of the things for me that's always like how could I possibly ever get those compression on after a surgical event? It is a mind-blowing concept to me, so I'm not really sure how that happens, let alone wearing it for 24 hours a day is like, 16 hours is a lot, so I'm not really sure.
Well, so just, one of the things is you find, and this is why sometimes easing into it, if it's really, a lot of sensitivity, if you, even the lower grades decrease the inflammation, and so then as that inflammation decreases, you're able to tolerate more. And I without fail, everyone at the end is like, oh, I like my compression, and everybody at the beginning is like, I hate my compression. So
and you even have people do some of the circade wraps, right?
Yeah,
to really get as much congestion out as possible. And of course, whatever, if you are somebody who has a decongestive pump, and that's definitely important. Anything that we can do to break down the congestion and really facilitate, like breaking down whatever fibrosis, it makes any type of the procedure easier, because they can navigate the cannula much more easily, and they don't have to fight as much with what you're trying to get at, right?
Yeah. So we can see this tissue becomes softer, less swollen, even less red, which is crazy. But it actually just nutrition and exercise and compression all can help improve the quality. You can see, everybody sees it. Everybody can see the improvements just from these very simple measures.